Hi, good afternoon, everyone. Thank you all for taking the time to be with us today. We are excited for today's webinar titled Stronger Together, Leveraging School Community Partnerships for Prevention Success. My name is Jessie Gallagher. I'm a trainee associate here at CADCA. I will be assisting with the technical side of the webinar and also helping to facilitate any questions that you have. I do have a few housekeeping tasks. First, that this webinar will be recorded and used as a training tool for the prevention field. We will be uploading it to our CADCA website, so you will be able to view it after the fact as well. Secondly, there will be plenty of time for questions and answers, so please make note of any questions you have. You can put them into the chat box or use the Q&A feature, and we will address those at the end of the webinar. I will now turn it over to Bobby to introduce our speakers for the day.
Jessie. Good morning, everyone. I'm Bobby Boyer here at CADCA, a Deputy Director over the State Coalition Institute and our customized training services. And I'm just really happy to be here with my friends Deb and Cricket from Ohio today and hear their great presentation. I just want to give you just some encouragement. I'm so glad that you're here to hear this because in my opinion, they're one of the best models that we have in the country. So you really got some great experts on the line today. I see that some are putting in the chat where you're from. Please continue doing that, get to know each other during this time frame. And I'm going to toss it to Deb and Cricket so we can make best use of their time today.
Thank you, Bobby, and thank you, Jessie. And good morning, everyone. My name is Cricket Meehan. I am the Executive Director of the School-Based Center of Excellence for Prevention and Early Intervention. And Deb, I'm going to pass it to you while also attempting to share my screen while you introduce.
Certainly. My name is Deb Robison, and I'm the Director of Outreach and Collaboration at the Center. And we are really excited today to talk to you about one of our signature programs and how this can work in conjunction with community prevention coalitions around the country.
Let me see if I can get it into the correct setting. All right, Deb, can you let me know if you can see that correctly?
Yes.
Awesome. All right. So I am probably the least tech savvy on the team. So I'm going to give myself a pat on the back for getting this going in a really strong way this morning. So again, thank you all for letting us join you today. It is our pleasure to share this topic with you. And it's fabulous to see so many people on a webinar on a holiday week as well. So thank you all for being passionate and joining us today. So what we're going to do in today's session is talk about some of our signature programs that we've developed here in Ohio, including our student assistance program. And we hope that one of the things that you all will benefit from today is learning about how you can participate as a community member or as a coalition member or in whatever role that you are serving in those student assistance programs within your local school communities. Our second objective is to explain the benefits for you on how to integrate another of our key signature programs, our staff wellness framework, into your work. And then at the end of today's session, it is our hope that you're able to list strategies, and in this case, at least 3, that community partners and coalition members can use to really aid in effective student and staff wellness programs and implementing those programs in your local setting. So again, we are the School-Based Center of Excellence for Prevention and Early Intervention. We're located in Oxford, Ohio at Miami University. So that is our hub for our offices. We serve the entire state of Ohio, and we're actually now moving and shifting more toward a national approach as well. So we're really excited to see all of you here today representing all of the different areas of our nation. Our vision at the center are that all children and the adults who support them are healthy and thriving. We've initially done a lot of that work here in Ohio, but it extends to all children and adults. And to do that, our mission is really to build confidence, competency, innovation, and school-based prevention and early intervention. And so what that looks like for us is this next slide. So you can see at the top there, we have some guiding pillars of our work. Everything that we do, we hope that we do that with this lens of being sustainable, equitable, collaborative, and systematic. So what that looks like in terms of building confidence, we do that with our school staff, our service providers, our caregivers, our families, our community partners, coalition members, whoever it may be, building confidence in developing a community of prevention and early intervention so that everyone is coming together with that prevention and early intervention lens. Building competency for our communities and our partners so that they're able to adopt and adapt these school-based prevention and early intervention evidence-based practices, and over the long term, sustain those practices. To build capacity for innovative approaches, we're really looking at what are some of the solutions to the school mental health crisis that our country is facing. How can we be more innovative, and how can we bring partners, community members, coalition members into the conversation to really drive new and innovative approaches to help and to get to our vision that everyone is healthy and thriving, and to increase access to those supports, those practices and those supports. So together, if we're working together, we hope that we are reducing some key things like office referrals or risky behavior, like substance misuse, suicidal ideation, and violence. And we're also hoping that we're increasing some critical pieces as well. And those can include things like access to mental health resources and services, staff wellness, and then increasing our students' ability to have career and life skills that will aid them as they move forward in their lives. We're going to talk today about some really exciting things. Our Ohio School Wellness Initiative was the foundation where we created our student assistance program model and our staff wellness framework, and we're going to talk about that initiative. We were also able to do some pilot work with local communities, and that's what you're seeing on this screen. Our current work is with 14 coordinators across the state. You can see those little pins in our state map of where our coordinators are located, representing 13 different districts. And these coordinators are serving more than 10,000 students across our pre-K through 12th grades. These schools are also representative of our rural, suburban, and urban districts in Ohio. And we have 3 additional schools that were not funded through our efforts, through our initiatives, but who self-funded coordinators and who asked if they could join in getting that technical assistance and that support and all of the resources that we're providing our funded schools. So we have those additional schools as well. And Deb's going to talk about some of this work as we go, but we just wanted to give you sort of the lay of where everyone was located and who it is that we're talking about today with these success stories that we're going to share. So why student assistance programs? So this is one of the core foundational models that we developed in our Ohio School Wellness Initiative. We know that student assistance programs have been in use for almost 50 years, and the Substance Abuse and Mental Health Services Administration, or SAMHSA, has created a guidebook, and momentarily I will pop that guidebook into chat for everyone. And I'm just looking at my chat button right now. So Jesse, I may have to pop it in to hosts and panelists and then have you send it to everyone because I'm not seeing everyone as an option on my list. But I will provide a URL for SAMHSA's Student Assistance Program Guidebook, and then everyone on this call will have access to that. But we know that this evidence-based practice is something that is a foundational model in our country. In the Ohio School Wellness Initiative, we used that model to build we adopted the SAMHSA model and then adapted it for Ohio, and you'll have access to our model as well. So one thing, let me see if I can get back to my screen here. So some of the reasons why student assistance program models are so crucial is that we know we have substance use and mental health challenges among our young people. You can see the statistics here, young people who are reporting drinking alcohol or binge drinking in the last 30 days, are young people who are reporting past year marijuana vaping. We have young people reporting major depressive episodes and persistent feelings of sadness or hopelessness over the past year. And we also know that suicide is the second leading cause of death for our young people ages 10 to 24. So clearly, substantial issues and concerns that we have as a nation. So what I want to do is I want to share, I feel like I missed a slide. one of my slides is missing, but that's all right. I'll go to the video. This video is it's from a student perspective, talking about the importance of a student assistance program. So I am going to start the video. Deb, if there's any concern with hearing or seeing the video, please let me know.
If you were like me, coming to school every day isn't always that easy. Yeah, I can do the math or memorize the dates in history, but it's
Whoops.
the other stuff that sometimes gets in the way. For me, it's my anxiety and depression. Being around other people that don't seem to get it or even care about it can be hard. And when I'm struggling with that, it is hard to stay focused and let go of the small annoyances that pop up in class, the hallways, or the cafeteria. I also worry about some of my friends. Some are drinking, vaping, or smoking weed. I have a couple of friends that seem to have an unhealthy obsession with their boyfriend or girlfriend, who frankly isn't that good for them. They will sometimes share what is bothering them, but it's hard to help my friends when some days I can barely take care of myself. I hear from my teachers and my parents that I'm not alone, and a lot of young people feel the same way. The research apparently agrees, but that doesn't make it any easier. One thing I did find that helps is our school students assistant program. This program is different from some of the others that people have asked me to try. For starters, they actually listen to me. They asked what I thought was going on, what I thought would help, and who would be good to support me along the way. I get to sit down with some of the teachers, administrators, and mental health experts in my school and learn about some of the different services it has to offer to see if any would be a good fit for me. I had no idea there were groups where people were going through similar things, could chat and support each other. It helped me so much that I even arranged some of my friends' assistants too. They didn't all need help during school either. One was able to connect with a therapist after school each week, and she's definitely feeling a lot better having someone to talk to. So if you are struggling or know someone who is, talk to the person you trust at school to get started with the Student Assistant Program.
I'm going to go to the next slide. This is where Deb is going to join in, and she's going to start talking about our Ohio School Wellness Initiative Student Assistance Program model. So Deb, I'm going to turn it over to you now.
Thank you, Cricket. So Student Assistance Program is really a systematic approach. And if you remember from the earlier slides, systematic is one of our pillars. And the idea is that we do things in a very intentional, systematic way, and we build it around the tiers of intervention. This is something, if you work in schools, you recognize the triangle, the tiers of intervention. If you are familiar with public health models or coalitions, you understand the tiers of intervention as well. And so this isn't a way to go around the tiers of intervention. It's a way to kind of build up and support those tiers. And what makes a student assistance program evidence-based are the six circles around the tiers of intervention. I neglected to say in my introduction, I worked in a school district for 22 years, and I was the director of our local drug and alcohol prevention coalition. So this model is particularly impactful to me because this is how I try to do business in the school with my community partners. And really it's around building awareness. So building awareness in teachers and community members and parents and students around what are mental health concerns and what is substance misuse and abuse. You all know that today we live in a world where things are not always considered what we considered a substance a while ago. We may not consider a substance now, or so those kinds of things. That it's really based in prevention. Again, as a school person, I completely recognize that we deal a lot of times with what's right in front of us and very reactive. And so this model tries to move us toward prevention, early identification or screening. We do lots of other kinds of screenings. We do vision screening, hearing screening. And this model asks us to think about how might we do other kinds of mental health and substance misuse screening, that we use evidence-based interventions. And for coalitions, you are used to using evidence-based coalitions and you being data-driven, so you know how to do this, and your expertise would be really important for schools to help with this. That there's a dedicated referral process. Schools move really fast, and so frequently I'd be walking down the hall and somebody would say, "Hey, can you see Johnny?" Like, no, but I can help you write the referral right now. So we do this, and so whatever that is, whether it's a pencil paper referral, whether it's a Google form, whatever that process is, part of that building awareness is making sure that everybody in the community knows how to make that referral. So whether you're a parent, you're a teacher, a student, a peer, maybe you're the librarian who has a concern about a child, do you know how to make a referral for a kiddo? So making that systematically known to everybody who might have some connection. And this idea of guided supports, that there's a team around this that does this work. And this is where coalitions shine, right? They're good at being parts of a team. And so we encourage coalitions to work with schools to be part of this student assistance program. Can we go to the next slide, Cricket? So student assistance programs are kind of all of these things that are listed. These are kind of the characteristics. They're comprehensive, they're cross-disciplinary, they identify barriers and address them. They're flexible, they're evidence-based, they focused on prevention. You see I've got two little asterisks there because, again, we sometimes in schools we're very reactive and not necessarily prevention focused. And they have family and community involvement. Again, a couple little stars there to say that this is not a model that should be done just inside the school with no community input and no community support. And that it addresses a whole continuum of support. So all of the universal prevention, all the way up to the selected, indicated, and prevention. So okay. So this is probably, you've all seen this. You've all seen this model. I think this is actually something that a group in Maryland put together. But there are 12 sectors that come together to make up a really great coalition to solve local problems. And this same idea is what we talk about when we talk about doing a student assistance program, that you need to bring together lots of different entities, and some of those are school-based entities and some of those are not. Now, you may not need media at your SAP team, but you need somebody that can help you with marketing and somebody that can help you get the word out to people and figure things out. So this is, again, the skills that community coalitions have and bring to the table are the skills that would benefit a student assistance program in growing and making sure that kids' needs are met. Go to the next slide. So just 5 steps to better school community collaboration. And I'm sure all of you probably know this. If you don't know, if you couldn't rattle them off, you know this in your, in your being, that we need to expand the vision of school to include the community. Schools can't do it alone. They have a lot of things on their plate that they are mandated to do, and not all of those things can be done alone. Reaching out to stakeholders, being included in that, expanding your vision of the school. Who are our stakeholders? Who are the people who really should be involved with this work that we're doing? And I would suggest coalitions should be part of that. Creating a community resource map. My guess is many coalitions have already done this. So how might we share those resource maps that schools have created and community coalitions have created? How might we connect with the curriculum? And what I think I would hear you saying if we were in the same room is, we have all of this great curriculum and we can't find our way in to deliver this curriculum. And we're going to talk about that in just a second. But right now, at least in Ohio, and I'm guessing around the country, there's a lot of movement around suicide prevention and substance misuse prevention that's being mandated at the state level. And this is where community resources can really come in and save the day. Schools don't necessarily readily have this information available and or know how to do this work. And this is the place that we can intersect with schools and really deliver solidly on good prevention information. And then designing a challenge for the whole community. Finding a way to bring community partners, including the school, around whether our community challenges we're going to be a healthy community or we're going to have more substance abuse awareness, whatever those community challenges are, bring everybody in step for that same goal, that same vision. We do the next slide. So this, I wanted to share this with you because one of our counties here in Ohio, one of the Educational Services Center spent quite a while putting together this training series. It's an online series. It's free. You can use the QR code. You can go to this. And it's very specifically designed for prevention services in schools. So it helps schools figure out how they might be better at doing prevention. And I share this with you again because it's a free tool. And this might be the thing you can go to a school and say, hey, I have this, it's free. You know, is this something you'd be interested in? And it really, it's a nice melding together of prevention and school language so that it makes everything a little more kind of concise. All right, can we do the next slide? So we've talked a little bit about the student assistance program, and when we started this model, well, the way we started was we had 80 schools around the state of Ohio, and they were really excited about the work, and we had manuals and tools and fidelity checklists and a lot of different things. And Cricket, as I see her putting those things into the chat so that you can have access to them. All of our materials are free, so you can certainly use those and implement those, take those to schools that you work with, and it's all completely free. But what we heard from our schools was, this is wonderful, this is great, and you've given us one more thing to do. And they were right in a way. To be really connected and intentional about this work, you really have to have somebody who can do this and not just kind of be an extra thing on their plate. So with that, we were able to pilot the second piece of the work, which was the behavioral health and wellness coordinators, and really started using them as prevention partners. So the slide that Cricket showed you earlier was the slide of Ohio, and they had the 14 schools and the 3 bonus schools. This is what we're talking about here. So Cricket, can we go to the next slide? So behavior health and wellness coordinator is a building level staff person, not a district level, not a 2-building, a building, one coordinator per building. This is our model. Now, we understand that people do things differently, but this is our model. And the idea is that they are there to improve access and availability of evidence-based promotion, prevention, early intervention practices. So for all of you who struggle to get in schools because the principal is too busy or the counselor can't get back with you, or you're not sure even who to talk to, we find that having a behavior health and wellness coordinator, this is their job. This is their job, is to coordinate all of these outside services, all of these prevention services, all of the efforts, and to make them accessible to students, accessible to parents, to make the schools accessible to partner agencies. Let me go to the next slide. So they really serve as a liaison with members of the community. So if there is somebody in one of your schools who has a role similar to this, I would get them into your coalition pronto, because they should be part of the work that you're doing. And that's that relationship that can build back and forth. They should have expertise in multiple systems, and they should be integrated into the school system and the community. and they understand that partnerships are where it's at. The partnerships are the main thing that they do. Next slide. So this is a non-direct service role. So this is, and I'll tell you, we had a little bit of pushback from schools when we first started this work because people wanted more therapists. And the reality is we are not going to have enough therapists to deal with any student who could possibly have a need. Even if there weren't a behavioral health work shortage right now. So this non-direct service provider really is involved in the coordinating and the implementing, evaluating, sustaining, innovating, all of those pieces that principals don't have time to do, counselors don't have time to do, intervention specialists don't have time to do. This is their role. They develop plans, they implement plans, they obtain feedback and data, they put all of the pieces together. They work with outside organizations. They work internally within the school. And one of my favorite things is they use evaluation data to inform decision making. That can be attendance data, that can be discipline data, that can be student drug use survey data, that can be any data that would help them make decisions about what services should and should not be in the school and where they should be placed. Can we do the next slide? So you would all will recognize kind of our wheel of promotion, prevention, treatment, and recovery. And this really is what a coordinator, if they're successful in their work, they are really good at finding the services that fit into promotion, into prevention, into treatment, and into recovery. And they're really good at it because they know who in the community can do those things, and they help get them in there. Again, the beauty of not being a direct service person is that they're out gathering the resources and bringing them into the school and making those school community connections. Can we do the next slide? So all of our coalition folks will recognize the SPIF, how we plan and how we go about doing things. And the coordinator right there in the middle is the translator. So when I was looking at the Ohio Department of Education and their continuous improvement plan, oh my gosh, does this not look incredibly similar? Identifying critical needs, researching evidence-based practices, planning, implementing and monitoring, and examining and reflecting and adjusting. Those are the very same things that we use in the SPIF. And the reality is when you have somebody who can translate back and forth, who can help the schools understand that we're not doing things much differently in prevention than we are in education, it makes a difference. And lest you think this is just Ohio, let's show the next slide. These are the continuous improvement models for Oregon, Oklahoma, and Massachusetts. Just must have run out of color on their copying. But everything else, you can see it's all very similar. So wherever you're at, learning that language and helping to translate that and helping to see if schools are in the, creating strategic plans, where does that fit into the SPIF model and how can you work cooperatively with them? And so really the role of a coordinator is to develop and implement the student assistance program, strengthen prevention and intervention in the tiers 1 through 3, and promote school staff wellness. And I'm going to turn it over to Cricket and let her tell you a little bit about the third component of our work, which is really staff wellness.
And as I start, I'm going to go ahead and pop this in, Jessie. So if you can share this staff wellness manual. Thank you for sharing all of the other ones with our participants. So staff wellness is a crucial piece of the puzzle for us here in Ohio. And I will say for many years doing this work, we've focused on our students, rightfully so, and provided a lot of those services, those supports, and that awareness and informational kinds of things related to students. But we neglected for years our staff. And I think now we in Ohio are really prioritizing staff and understanding the crucial piece that this plays in this work. let me see if I can get my slides to advance. Apparently I cannot talk and navigate at the same time. So in Ohio, again, we implemented our Ohio Ohio School Wellness Initiative. And really, this was some groundbreaking work that we did, where we were creating these foundational models. But not only did we create the models, we were piloting the model in 80 of our schools. And so we had 80 schools representative of all of the different demographics in Ohio. So we were able to really see, are these programs working? And are we helping the staff in the way that we need to? So we were able to provide them with this meaningful wellness support because we saw that they were experiencing some significant concerns. So you can see that among our teachers, our staff here in Ohio, 64% of them were reporting to us being emotionally exhausted. 58% of them were expressing that they were feeling anxiety or worry on a pretty regular basis. And as many of you know, we saw in recent years kind of droves of educators leaving the education field because of this experience of burnout, the stress that they were experiencing. So we knew collectively that there was a concern and a problem, and we knew we needed to address this. So why staff wellness? Well, we know that if our staff have their own needs met, that they're able to be motivated, happy, positive, if they're helpful, if they're joyful, all of the words that you're seeing on this word cloud. Not only is that going to help them do their job better, they're going to support the students better. So the students' experience will be much more positive as well. So we, again, prioritized providing this framework that staff can use to focus on their own wellness. And we did that with the SAMHSA's foundational model. So I think you have that now. Let me double check my chat here. Yep, so that wellness guide is out there. Our wellness guide, we adopted SAMHSA's staff wellness model, and then we adapted it to work well here in our state. You can adapt things to work well in your local context also. But our staff wellness model focuses on these 8 dimensions of wellness, which may be very familiar to many of you on this call. So you can see that there is the emotional, the physical, intellectual, financial, environmental, spiritual, social, and occupational dimensions. All of those dimensions are key for an individual's wellness. And often we found that people were focusing on maybe 1 or 2 of them, but collectively, if we're able to get people to recognize and identify areas of improvement in all of them, and then start to implement positive strategies in their own wellness, we see some substantial improvement in their experience. We also partnered with Joyce Adidison and her company to bring us the wellness improvement system model. And so we layered this model over, this was our adaptation in Ohio for SAMHSA's foundational 8 dimensions of wellness. Joyce's model has very similar dimensions with, if you see in the center, an interpersonal model as well. So that relationship with self and others was crucial for our model. So you can see the similarities there. And when people were implementing our model with fidelity, we're seeing some really positive things happening. So this is just an example from one of our schools that we've worked with. So in their building, they were seeing substantial changes in a variety of factors. And you can see this data came from their school year in 22-23. What they were finding was in the building, they were seeing an increase, a 7.6% increase in that feeling of belonging among their staff. So their staff were saying that they're feeling like they're valued members of the school community. And you can see that little asterisk there. So what that is telling us is that in that one building who they were implementing our staff wellness framework, whereas in the rest of the district, they were not, their numbers were 23% higher than the district average. In climate, we were seeing a 92% increase in that perception of social and learning climate of the school going up. And again, that was a 75% higher average compared to their district. In well-being, that number went up 60.8%. So their own perception of their professional well-being. So we're seeing tremendous positive numbers happening in our staff when they're implementing the staff wellness framework. So again, success. And at this point, I'm going to turn it back over to Deb because she has some success stories from some of our other school partners. So Deb, I will let you take it away.
Sure. So we know that when we have a really strong coordinator in a building, and when they're doing student assistance programs and implementing staff wellness and connecting to the community, we're starting to see some results. So we're entering, it's actually year 4 for this, the student assistance programs, but year 3 for our having behavior health and wellness coordinators. We do have a grant from Project Aware. So when you're seeing year 2, quarters 1 through 3, those are the fiscal quarters, which really span over the course of the whole 22, or I'm sorry, the 23-24 school year, minus about 2.5 weeks. So just it's essentially the whole year, a school year. So in our 14 schools, or of our over 10,000 students, there were roughly 1,900 students screened for some kind of with some kind of mental health or suicide or substance misuse screening. Of those, 470 were referred for ongoing services, and 201 students actually connected to services, which we're really excited about because those are students that may not have been seen otherwise. Can we go to the next slide? One of the things, if you remember in the circle, was providing mental health awareness. And we did that through some training. We did 60 trainings in our 14 schools, and there were 878 individuals. And just the caveat to that is some of these may have been duplicate people that showed up for different trainings, but these were some of our top 5 or 6 trainings that we did. So we are talking to families about the neuroscience of the brain. Some of our schools are utilizing the CALM app, so they're learning how to do that. Sexual abuse and violence prevention training, sources of strength, the suicide prevention training. Drop Those Rocks is about self-care and boundaries, and then some more boundaries kinds of training. And those are just the top ones. Like I said, we had 60 different trainings. Can we do the next slide? And these were student trainings. So in our 14 schools, there were a total of 457 trainings. And again, over 10,000 students participated. Again, the same caveat, these could be same kids that are doing having a couple of different exposures to different trainings. So signs of suicide, Sandy Hook Promise starts with hello, Sandy Hook Promise say something, sources of strength, and sexual abuse prevention. So we're working really hard to make sure that students have their own sense and their own knowledge and awareness to move forward. Go to the next slide. So we talked a lot about community partnerships, and this is one of the things that I'm really excited about. That in our schools, we do formal partnerships, or those are partnerships that have some kind of MOU or a contract, some formal agreement. And you can see that those kind of surround community organizations, businesses, life skills, social emotional learning, and mental health organizations. And these are just some of the organizations that we have formal arrangements with. So some kind of contract, some kind of MOU. And you can see that they're pretty broad, especially in the community organization, the Equine Wisdom Institute, martial arts, Summit Comedians, dance. So these are all folks that are in some way working toward the goals and the objectives of the school around mental health and mental health awareness and mental health access. Can we go to the next slide? These are informal partnerships, and this I find really encouraging, because these are the partnerships that our coordinators have connected to, that whether there's not necessarily a formal agreement, maybe they come in, they're doing one thing, maybe they're doing a couple of things, maybe it's broad in what they do. But we know that you can see on the second slide, the community organizations, there's so many more, and it includes religious organizations, youth service organizations, consulting, healthcare, mental health organizations. So the role of the coordinator in being able to get out there and connect with the community is so important for schools in terms of bringing in the resources that young people and families need to be successful. And kind of the thing that really excites us about all of this is, well, let's go to the next slide. So as we're talking to schools, we also have to talk about, you know, we as prevention folks, we want to see our numbers go down in those 30-day past use and you know, some of the experiences, the substance use experiences that kids are having. But we're also finding that when we're doing these things, we're hitting the mark on what schools need and what it encourages schools to stay committed to this work. We saw 15% reduction in absenteeism, an 11% reduction in out-of-school suspensions, and a 35% reduction in expulsions. And we know from data, we know that when kids are at the out-of-school time, whether it's that 3 to 6 time, or whether it's because they're home because of one of these reasons, those are high-risk times for our young people to be using substances. So the more we can keep them in school, because they're present, because they're not suspended, because they're not expelled, the better for our substance misuse data as well. One of our favorite things that we like to share is our next slide. In our 14 schools, we had a return of $4.8 million in services, or approximately $340,000 per school. And that's important because these are services that the coordinator may have worked cooperatively with somebody to bring a service in. Maybe they wrote a grant, maybe it's a partnership, maybe somebody else had a grant and needed a place to do a service. But these are things that are not costing the district dollars. And while 340,000 is a wonderful number, that represents services to kids that are making a difference in their lives and making a difference in their ability to be successful and not use substances. So that's kind of our big aha moment at the end of this. I'll turn it back over to Cricket to kind of wrap us up.
So we just want to say thank you to everyone for letting us join you in this presentation. Our contact information is here, and Deb and I would both love anyone to reach out if you have questions or if there are stories that you thought of related to this kind of work that are happening in your area. We love to hear success stories from local communities. So you have our contact information there. You can see our logo. We have our website is the ohiosbcoe.org. So you can go to our website. All of the resources that were shared today are on that website. We do have an info address as well. So if you send anything to our info address, that will get to us. And then we have our QR code for our social media there. So if you want to take a moment to do that. As we were going through the session, I see some questions in chat. I was not able to type responses in chat. I don't know why I'm not set up for everyone. So I'm going to attempt to answer some of those questions now that I remember. And so Deb, one of them was, I think, related to the Montgomery County's resources that you provided the QR code for. I think the question was, is there a URL potentially that could be shared in chat that would make it easier for people to navigate there? So if you have that, go ahead and pop that into chat. And I think there was another question related to, has anyone looked at connections to, I believe it's the Lokahi wheel? We have not done that. I'm not familiar with the wheel. My guess is that it has a lot of connection and is similar to the prevention kinds of models and the other things that we've shared here today. If anyone else has used that or has connected this type of work with that wheel, if you could pop any response into chat. It looks like that was Timmy Foster who asked that question. And then Jesse, is there any other questions that have come in that I've missed? I see there's a new one. Do we connect with state health or education departments? So Deb, do you want to take that question about whether we connect with state health or education departments?
So in Ohio, we work really closely with both the Ohio Department of Education and Workforce, and we do work with the Ohio Department of Health. There's some work going on currently around pediatric psychiatry that we're involved with, and just providing some support and technical assistance and consulting on that a little bit. And we also work with the Adolescent Health Project here. So we work where it makes sense for us to help bring information to schools and school information to other organizations. So Cricket is fond of saying that one of our jobs is to break down silos. So we work hard to make sure that silos are being able to be crossed and talk back and forth.
And I'm going to go ahead and stop sharing so that you can see us again. And Deb and I can stay and answer any other questions. If there were questions that were in chat, I may have missed some. So if you asked a question, please pop that back at the bottom and we can answer that. And if anyone has any other questions, we're happy to stay and answer them. Oh, I see another one. So Deb, this one's going to be for you. Oh, it went really fast. Where did it go? There it is. Are the behavioral health and wellness staff contracted by the school? Who do they work for?
That is a great question. We have a couple that work directly for the school. That is actually not our preference. Our preference is that they work for a mental health or a prevention organization and are placed in the school. And part of the reason for that is, again, back to breaking down the silos, schools educate really well, and mental health organizations provide mental health services really well. So how do we pull those two systems together to work cooperatively and collaboratively? And we've seen a couple of really, great things happen because the coordinator was from an agency and they were able to get some things realigned, not just for her school, but for other schools in the area, because the mental health agency just didn't know that that's what schools needed and the best way to do that. So there is a lot of value to that. I will say that some of our coordinators, that is a frustration point too, that they have feet in both worlds, right? They're part of the school. That's where they're housed, and they're also part of this other agency. And by the way, there's people at Miami saying, "Hey, can you do this? Can you do that?" So they get pulled in a lot of different directions, and it takes somebody with some real skill to be able to navigate all of these different priorities, these multiple priorities.
There's a few more questions that came in. I'll answer
Sure.
the chat ones. And Deb, there's one in the Q&A that came in that I'll have you answer in just a moment. That is, how do substance use prevention coalitions outside the school district get involved with SAP? So I think kind of a summary of how coalitions get involved as well. The chat questions were, I think Deb answered that one. So do you offer mentoring? Would we just reach out to the email address you provided? Yeah, so Deb and I, if you want to just contact us, we are happy to provide mentoring. We're happy to answer questions. We're happy to connect you to others doing this work and maybe those in your local area who we know that do similar kinds of work to get you started in that direction. How many schools do the behavioral health and wellness staff work with at a time, or do they focus on just one? So we embed our BHWCs in a single school. We find that model is really helpful because then they're able to focus on these comprehensive foundational models and systems and really serve the students and the adults in that community to the best way possible. Let's see here, which one did I miss? Can we show the slide with our contact information? Yes. And there's one other slide that I will try to pop on if I can find it. We had a data slide that didn't show up the first time around. So I'll pop that slide on again with our contact information. And how does the funding work? So Deb, if you want to take, how does funding work? And do you build Medicaid? It says Medi-Cal, but the billing piece of that. So if you want to take those two questions while I pop on potentially a data slide and then our contact information slide one more time.
So I'll do we do not do any billing. That would really be for some kind of direct service. And since we don't do direct service, we don't bill for any of that. The funding right now for our schools, it really comes in a lot of different ways. The original funding came through the Ohio Department of Mental Health and Addiction Services through their early intervention dollars. And then we applied for a Project Aware grant and received some funding through Project Aware, which has been helping sustain the work for the last few years. However, though, the intention of this work was always that it would find its way to reside in the schools and the mental health board, the local mental health boards. So even now, the funding comes from the Ohio Department of Mental Health, and it goes to the local mental health board to contract with an agency. And I realize that seems very convoluted, and in some ways it is. But the idea is that we have had a lot of success. We've had about 3 of our local mental health boards who have said, okay, we're going to realign some of our prevention dollars to go into this direction. Or we have this kind of program that we're not seeing much success with, that we're going to put some of those dollars into this. We also have schools in Ohio. Our schools have a pot of funding. That's the school success funds or school wellness dollars. And when Bobby was with us, Bobby was instrumental in getting language written into the legislation that says 50% of your dollars must be spent on youth mental health for school wellness, for student wellness. And if you hire a behavioral health and wellness coordinator, you can use those dollars for this. So some of our schools are starting to contribute, not the whole amount, but some. Now, the really interesting thing is our what we call our bonus schools. Those are the schools that found other funding, but we provide the technical assistance, the training, the support, the coaching, those kinds of things. They found funding in several different ways. One found funding through a local foundation, and they worked with the local foundation. The model is the same. They do everything the same, but the local foundation helps to pay. Another area, the school board and the school board and the local mental health board split the cost. They just said, okay, we're in, and we split the cost. And we just started working with the Ohio Appalachian Children's Coalition, and they had some federal funding, and they're paying for it that way. It is tricky. We know that it's tricky. One of the things that we're doing at the center is we're working right now to create a behavioral health and wellness coordinator certification, because we know that there are other people around the state that have job titles that are doing something like this, but maybe not all the components. So one of our goals is to have this kind of badge or certification process that we can help, hopefully we can help elevate some of the work that's going on in the state, where people are doing pieces of the work, but maybe not all of it. So that's what we're trying to do with that.
And I'll jump in really quickly, Deb, for this slide. This one, for whatever reason, didn't work while I was toggling through the slides, but I just wanted to share this. This is the reason why we know BHWCs and these models are needed. So during COVID, we collected some data locally. You probably have very similar data in your local area. That during COVID, we know that all of these concerns either stayed the same, which was the yellow, or they got worse, which is the red. And even the ones where we're seeing a little bit of decrease, like you see behavior problems potentially decreasing, we actually are suspecting that that's because we didn't have eyes on students when they were at home during these stay-at-home orders. So potentially these behavior problems really didn't decrease. It's just our observations of them were not happening. I'm going to stop sharing just for a second. I'm going to go to, if I can toggle to my screen with the very last slide and give you our contact information as well. So Deb, there was another question while I do that of what degree is needed, or what are the staff credentials, if you want to answer those questions. But I'm
Sure, that's a great question.
I'll pop our contact information on shortly.
And I did put the link in for, Jesse, I don't know if you can help with that. I put the link in for that QR code so that people can go to that directly. When we wrote the staff guidance document, which you should have a copy of that also, we were pretty clear that it wasn't necessarily a specific discipline that would be the best coordinator. So we have some social workers, we have some intervention specialists, we have people who have child welfare in their background, we have somebody that was in corrections, we have somebody who was a former school nurse. And what we found is that it's really not the discipline, it's not the educational discipline. We do ask that people have a bachelor's degree, but it's their skill set. Can you manage multiple priorities at one time? Do you even want to do direct service? We've had people that got hired and then very quickly decided, nope, they want to do direct service. They want to be doing counseling with kids. They want to be interacting with kids more. And it's not that you don't ever interact with kids, but that is not the bulk of the day interacting with kids. It is doing these other things. So it's really, can you look at data? Are you comfortable going out into the community and saying, hey, this is where our need is. Can you help us figure that out? It is truly this multi-systems kind of person that has to be comfortable in a lot of uncertainty. We say the common denominator is we've been one of the things that we offer to all of the coordinators is we have a person who is coaching them and working with them on getting their Ohio Certified Prevention Specialist, their certifications in prevention. And in the last 2 years, I just was working on this, and we have, of the 14, we have 11 who have attained some level of their prevention certification status. One, the very top, which we're really excited about. So that's what we're doing in that way.
See a question, are there any peer support specialists?
So some of our schools do because of where they're at. Each of our schools are very different. We have, all the different age bands, all the different, kind of demographics. Some of our schools don't have anything. It's just the coordinator and the principal. Some have, family peer support specialists as part of their team. Some have counselors as part of their team. Again, their role is to bring in and coordinate all of the services. So if there's a family peer support specialist, they should be working with that person and working toward making sure all of those goals and objectives are met.
So I know there may be other questions, but I want to give Jesse a chance to close out and get everyone on their way on time. We don't want anyone to go beyond the hour. You probably have other meetings and things. So thank you.
Yeah, definitely. Thank you both so much. I just did want to mention we had a few questions in the chat about the presentation materials. If you would like to email me at training@cadca.org, I can provide you the presentation and I'll put that email into the chat as well. And we also had a few questions about the recording. The recording will be uploaded to our CADCA YouTube within the week.
Thanks, Jessie. So I wanted to say just a couple of words. I wanted to punctuate Deb's explanation of the workforce development piece that that is part of this, is that, they're bringing people in from the workforce and then training them up and providing a credential for them in the prevention world. So keep that in mind, because I know there's a lot of prevention folks on this call. And I also wanted to say other funding possibilities are, some of you may have health and wellness centers going into schools. Some of those dollars can be used for coordinators. And there's also Title IV dollars and other federal dollars from the U.S. Department of Education that also could be used for this. So I just want to throw that out there. So I'm happy to say that Deb and Cricket are going to be at our National Prevention Forum that's happening on February 3rd through the 6th. So I would encourage you to check that out. I think Jesse's going to put the link to registration in there if you want to check that out and join us at the forum. So thanks so much for joining us, everyone, and we hope you have a wonderful rest of your day.